When a child comes back into foster care after being adopted, how can we best prepare them for another adoption to help decrease the anxiety or increase their confidence and give them a sense of security?
First, I want to validate that this is a big question. I have seen several kids who were in adoptive placements that have dissolved for multiple purposes. Sometimes the adoptive placements themselves end up being abusive placements, unfortunately. And so the rights are legally severed from those adoptive parents. Sometimes the adoptive parents dissolve the adoption because of the child's behavioral or mental health needs. It's a tough place to be for a child. And going into another adoptive placement oftentimes is very scary for that child. So the best way that we can support that child, that another potential adoptive family or an adoptive family can support that child, is we want that child in their social system. We want that child to feel safe to express what is going on internally for them, which means there are a couple of things that are going to have to happen in the environment. One, it's going to have to be a highly regulated environment. Highly regulated. We need that child to feel safe. And if it's a home that is highly punitive, if it's a home that is not emotionally available, if it's a home that is aggressive or harsh in any way, that child's not going to feel safe. Second, we need that environment to be able to relate to that child. So I see this happen very often in caregivers. When a child cries or throws a tantrum, what happens for the caregiver is that they get flooded with emotion. And so what do we do when we feel yucky inside? We want that child to stop so that we don't feel yucky, or we want to fix it for that child so that we don't feel yucky inside. That's not parenting for that child. That's parenting for us so that we don't feel yucky inside. What we need to do is we need to have a caregiver who can relate to the child. Even if we're feeling overwhelmed, if we're feeling yucky about what's happening for that child, we need to take a step back, we need to take some deep breaths, and we need to go in and validate what's happening for that child. Understand that if a child barely bumps their knee and it ends up in this meltdown, that knee might have been that little tiny thing that pushed that child over the edge to grieve that last foster placement, to grieve their history of trauma. And we need to give them the freedom to grieve, rather than saying, it was just a little bump, you're okay. Knowing that those tears are much more than a bump. Those tears are multiple years of hurt and heartache. So when a parent can relate to that child and validate that child on what they're going through, that's going to create what's called a sense of safety for that child. That is that child's that feeling that they have that they're cared and understood for. Okay. The third thing that the child can do is to again leave the conversation open for them to talk about. We want the child to have a safe place when they're comfortable to talk about what happened. And then validating for that child, I want to see you succeed and you're not going anywhere. You're here with me. And validating for that child, this is hard. This is a very difficult thing. And what happened in the past was really hard. What I would encourage adoptive families, and I say this just for the sake of, we just don't know what happens in the future, is that if you have a child that you're struggling with and you've adopted and you tinker on that line of, I don't know if I'm in this for the long run, you shouldn't be telling your child you're here forever. If you know that without a doubt, this child is here no matter what, you need to be telling that child you're here forever. But we don't want to give this child a false message. Now, I think most adoptive parents at some point say, oh, what did I get into? Was this the right choice? There's a big difference between saying, was this the right choice? What did I get into? Versus, I don't know if I'm going to keep this kid. There's a large difference. If you have that thought, what did I get into? Tell that child they're here forever. Another thing to keep in mind is that, and I guess it's kind of my overall picture, primarily we're going to look at the environment for that child to be safe. We want a caregiving system that's not rigid with the child. We want a caregiving system that's very flexible. We want a caregiving system that's attuned to the child. We want a caregiving system that's regulated. We want a caregiving system that can understand where that child's coming from and understanding that their behaviors are serving a symptom and a function. We want a caregiving system that can meet that child's needs.